start with cardiac pathologies. The first group of diseases in cardiac diseases is ischemic heart disease. So for understanding ischemic heart disease, we need to understand the blood vessels, especially the arteries. Right, so let us understand the arteries first. So chapter 15, Hirschman textbook of pathology. Arteries are the blood vessels which carry oxygenated blood, right? And these arteries have three layers in their walls, right? These arteries, the artery walls or the arteries are made up of three layers. These three layers are: number 1, tunica intima; number 2, tunica media; and number 3, tunica adventitia. Right? You can see in this picture tunica intima, tunica media, and tunica adventitia. Right? Tunica intima is the innermost layer, tunica media is the middle layer, and tunica adventitia is the outermost layer. Right? And this tunica intima is lined by endothelium. So we all know that the blood vessels are lined by endothelium in the inside. Right? The tunica media is the thickest layer which contains the smooth muscle cells and some of the elastic fibers, right? Whereas tunica intima, the innermost layer, it contains the endothelial layer and some other proteins like collagen, proteoglycans, elastins, and some glycoproteins, right? So tunica intima contains collagen and elastin and endothelial layer, whereas tunica media contains smooth muscle cells and elastic fibers. This tunica adventitia is having a nerve supply. It is having, the blood vessels are having their own nerve supply, right? And the walls of the blood vessels also have their own blood supply also. The vasa vasura is the blood supply of the blood vessels. So blood vessels are also supplied by the blood vessels, the vessels of the vessels. The tunica adventitia, the outermost layer, is having autonomic nerve fibers, it is having nervous supply, and it is having lymphatics also, right? Now these blood vessels, the arteries, these arteries, they also go certain pathologies, they also go certain diseases, and the three common headings or the three common types of those diseases are: number 1, arteriosclerosis; number 2, vasculitis, also called as arteritis; and number 3, aneurysms. So we are going to study arteriosclerosis because we are going to study cardiac pathologies, so we should be well informed with arteriosclerosis, but you should also read arteritis, vasculitis, and aneurysms. They are also equally important. So coming to arteriosclerosis. So arteriosclerosis is thickening and hardening of the arterial wall. Sclerosis is hardening, right? Sclerosis word comes from hardening. So thickening and hardening. When the blood vessel walls, they become thick than their normal size, and they also become hard. They lose their elasticity. So this arteriosclerosis is having many causes, or it can be categorized into: number 1, senile arteriosclerosis. Senile means pertaining to age, which with aging, as the age progresses, with old age, the arteries, they become thickened and they become hardened. So that is called as senile arteriosclerosis. Number 2, hypertensive arteriosclerosis. That is arteriosclerosis originating because of hypertension, right? Increased blood pressure. Then number 3, calcific sclerosis, where the arteries are having calcium depositions in them, abnormal calcium depositions, and they become calcific. So then they also becomes thickened and hardened. And number 4 is atherosclerosis. Atherosclerosis, when these arteries are having atheromas in them, the fibro-fatty changes in them, right? The fibrous changes and the fatty changes. The fat and the fibrous deposition is more. That is called as atherosclerosis. So we are concerned with atherosclerosis part of arteriosclerosis. But quickly, we can read these also. See these senile arteriosclerosis. In senile arteriosclerosis, what happens? The intima and the media, these two layers, the intima and the media, they become increased, they become thickened because of the increase in elastin and collagen tissue. So elastin and collagen tissue deposition happens in tunica media and tunica intima, and they become thickened as the age progresses. In hypertensive arteriosclerosis, the intima and the media, apart from having this collagen tissue in them, the elastic and the collagen tissue, the hyaline material in them more, they also have eosinophils and eosinophils in them, right? Eosinophils are also present in them. So in arteriosclerosis, these layers, tunica media and tunica intima, they become thickened and hardened because of the hyaline material and because of the eosinophils in them. Then we have also in hypertension, apart from the deposition of hyaline material in media and intima, there is hyperplastic intimal smooth muscle cell. That means this intima layer, which is generally devoid of smooth muscle cells, these smooth muscle cells from tunica media, they go into the tunica intima and they proliferate here, and the wall of the artery becomes thickened, the tunica intima becomes thickened. So hyperplastic intimal smooth muscle cells appear in the hypertensive diseases. In hypertension, this intima start developing the smooth muscle cells and they become thickened. Also, there is deposition of proteoglycans, hyaline material, and everything. Collagen, elastin fibers, right? So because of these collagen, elastin fibers deposition, the proliferation, hyperproliferation of smooth muscles in the tunica intima, it leads to the thickened and hardened arterial walls in case of hypertension. So hypertension and age causes arteriosclerosis. Next, the calcific sclerosis. In calcific sclerosis, there is deposition of calcium salts in the media that leads to thickening and hardening, that leads to arteriosclerosis. There is one more, necrotizing arteriolitis. In necrotizing, because of the hypertension, because of the increased blood pressure, there is deposition, there is necrosis of the vessel walls and deposition of inflammatory substrates, inflammatory cells in the adventitia, layer of the blood vessel wall, right, leading to thickening and hardening. So these are some of the pathologies, some of the pathogenesis. So now let us learn the atherosclerosis. So atherosclerosis is the type of arteriosclerosis in which the intima layer, mostly the intima layer, the innermost layer, is having fibro-fatty plaques, also called as atheromas. Fibro-fatty plaques or atheromas. Fibro-fatty means fibrous and fatty changes in them, right? Sclerosis. This atherosclerosis is having many risk factors. The most important risk factor is dyslipidemia. You can see it here, dyslipidemia. Dyslipidemia is the deranged blood lipid levels. Deranged blood lipid levels. That means some of the lipids, they are high and some of the lipids, they are low. Some types of lipids, they are low. The most important of among the lipids is the cholesterol. Hypercholesterolemia, that means increased cholesterol levels, leads to atherosclerosis, right? So the various types of lipids present in the bloods are, number one, chylomicron. You can see it here. chylomicron, very low density lipoproteins, low density lipoproteins and high density lipoproteins. VLDL, chylomicrons, LDL and HDL and cholesterol. So lipids are carried in the blood with the proteins called as apoproteins, right? So these various types of lipids, the VLDL, LDL and HDL and cholesterol, they causes their deranged levels causes dyslipidemia, right? We already know that the high density lipoproteins are good proteins, whereas the low density and the very low density lipoproteins, triglycerides and hypercholesterol and cholesterol, they are the bad lipids. The risk factors for atherosclerosis is number one, dyslipidemia. Dyslipidemia causes atherosclerosis, that is fibrofatty plaques in the blood vessels. Number two, hypertension. Hypertension causes atherosclerosis, right? We have already studied the mechanism. The diabetes mellitus, smoking also leads to atherosclerosis, right? Apart from this, the higher age, the elderly age, the sex, the males are more having risk for atherosclerosis, right? This is because of the estrogen hormone, presence of estrogen hormone in the female, which protects them from the atherosclerosis. Then genetic factors, some genes are responsible for development of atherosclerosis. Familial and racial factors, right? Some familial genes or some familial factors are there. Then environmental, some other risk factors like obesity, like hormones or estrogen deficiencies, oral contraceptives, physical inactivity, stressful life, right? High levels of homocysteine in the blood, alcohol, right? Prothrombotic factors, right? Raised prothrombotic factors in the blood, some infections, somebody is having an infection of herpes virus or cytomegalovirus, they are more prone to atherosclerosis. Then high CRP level, right? C-reactive protein levels, they are high. Those people are at risk, right? So you can read the dyslipidemia here. The total cholesterol, right? Total cholesterol is in the range of 140 to 200 mg per dl. Anything beyond than that is a risk factor for atherosclerosis, development of atherosclerosis. Triglycerides, the level is 160, the upper limit is 160, and more than that is harmful. Low density lipoproteins, right? Low density lipoproteins, they are bad lipids, and they should be, the limit is 130 mg per dl. Then very low density lipids, then high density lipoproteins, right? HDL cholesterol. High density lipoproteins are good or protective cholesterol, protective lipids, right? This is wrong here. It should be greater than 60 mg per dl, right? The levels should always be greater than 60 mg per dl, right? You can see it here. The levels should be always be greater than 60 mg per dl, and the levels greater than 60 mg per dl are considered as protective levels for development of atherosclerosis, right? For not developing atherosclerosis, right? Apart from this, the other risk factors are hypertension, smoking, diabetes mellitus, age, sex, genetic factor, familial and racial factors, right? You can read all of this by yourself. Now let us come to the mechanism of atherosclerosis. So we already know that atherosclerosis is thickening and hardening of the arteries. Thickening and hardening of the arteries, and atherosclerosis means the deposition of atheromas or fibrofatty plaques in the arteries. So arteries, we have already studied the arteries have three layers in them: intima, media and adventitia, right? So what happens because of the endothelial injury? Now in humans, this endothelial injury results from hemodynamic stresses. Hemodynamic stress. Hemodynamic stress means hemo means blood, dynamic means flow, right? And stress means stress. So because of the flowing blood, because of the fast flowing blood, there is stress in the there is a stress in the arteries. So when blood is flowing with a rapid pace, that generates stress, and if the pace of the blood, if the speed of the blood, or if the pressure of the blood is more, as in the case of hypertension, right, then that hemodynamic stress leads to endothelial injury, right? Endothelium becomes damaged. You can see in this picture, this endothelium here is denuded, or it is eroded, right? It is washed away with the blood, right? Also, apart from this, the second major factor is chronic dyslipidemia, right? Chronic dyslipidemia. Whenever the lipid levels, the dangerous lipid levels, the lipids which are dangerous, they are high in the blood, that causes lipotoxicity. Now this lipotoxicity damages the endothelium and causes endothelial injury, right? So high levels, if the blood is filled with high levels of lipids, especially the dangerous lipids, then that thing will lead to endothelial injury. So we already know what happens when the endothelial injury happens, when the endothelial injury takes place, right? We have studied this in coagulation. So endothelial injury leads to the formation of platelet plug, right, over the damaged surface. So whenever this endothelial lining is denuded, whenever this endothelial lining is eroded, right, it exposes the collagen layer or the elastin layer, right, the elastin layer of the tunica intima to the blood, right, tunica intima to the blood. So the platelets from the blood will go and stick to this injured tissue. Also the macrophages and the blood monocytes, they will come and they will go inside the layers of the blood vessels through these openings. Right, now what happens when the blood is having high levels of lipids, right, that is dyslipidemia. When the blood is in the state of dyslipidemia, then the monocytes, the blood monocytes, right, which enters through this damaged endothelial lining in search of any pathogen in the blood vessel, these monocytes, they contain the LDL levels, the LDL, the low density lipids. They enter the monocytes are filled with these low density lipids, and these low density lipids, they oxidize themselves in the monocytes, and that oxidized LDL levels in the monocytes makes those monocytes into foam cells. So foam cells are cells which are filled with lipids. They are monocytes which are filled with lipids, and as soon as this monocyte enters the layer of the blood vessel, that is tunica media, it changes itself into foam cells. So there are lots of foam cells. These foam cells, they go into apoptosis, they destroy themselves, and that leads to the release of lipids inside the tunica intima. So that is how the lipid enters into the tunica intima with the help of these monocytes, right? So you can see it here, role of blood monocytes. The LDL does appear in the monocyte cytoplasm to form foam cell, right? Death of foam cell by apoptosis releases lipids to form lipid core of plaque. So now there is, because of these foam cells, there is lipid deposition in the tunica intima. Apart from this, the tunica intima, which is rich in collagen and elastin material, and which is deficient in smooth muscle, right, there is proliferation and migration of smooth muscle cells from the tunica media to the tunica intima. So now the tunica intima is also having the smooth muscle cells, right? So apart from the smooth muscle cells, the collagen in the intima is also increased in amount, so that leads to the thickening of the intima, right? Thickening of the intima layer. You can see it here, step by step. So here you can see the intima is a thin membrane, right? But in this part, because of the endothelial damage here, right, the monocytes, they have entered into the intima layer and they have converted themselves into the foam cells, and they have released the lipid, they have released the lipids inside the tunica intima layer. Also there is proliferation and migration, the migration of smooth muscle cells from the media layer into the intima layer. So now the intima layer also contains smooth muscle cells and they proliferate. Also the collagen inside the intima layer, it proliferates. So it leads to narrowing of the blood vessel aperture, right? The blood vessel becomes narrowed, or you can say the blood vessels becomes thickened and hardened, right? Thickened and hardened. So now the intima having smooth muscle layer and intima having lipid molecules, right? There is deposition of fibrin material over the lipid material, and that leads to the formation of a fibrous cap over the core, right, which is rich in lipids, right? So these atheromas which have developed, right, pathologically, contains a central core which has a lipid pool and foam cells and some of the smooth muscle cells, and they are covered by a fibrous cap which is rich in fibrous tissue, fibrin and collagen and smooth muscle cells, right? So this lipid core is covered by a fibrous cap, or it is tightly covered by a fibrous cap. So this pathological state, or this particular state, is called as atheromatous plague, right? This particular structure is called as atheromatous plague, right? So you can see it here, the red color, the white fibrous cap and a central core composed of yellow, white, soft, porridge-like material, hence the name atheromas. Porridge means the fatty material, just like pig fat, right? So this central core, which has fats, they are covered by a fibrous cap. The fibrous cap is covered by endothelium and is composed of smooth muscle cells, dense connective tissue and collagen, proteoglycans and collagen, right? So that is the fully developed, you can see it here, the fibrous cap, right, and the inner core of lipid rich substances, right? It contains cholesterol, it contains very low density lipids, and it contains low density lipids. Now this atheromatous plaques, they are most commonly found in coronary and cerebral arteries. In coronary blood vessels, we will learn that how these atheromas, they causes coronary diseases. In cerebral arteries, in brain, they causes stroke, right? And apart from this, they can also cause damage to the other arteries, for example iliac, for example femoral, for example carotid we are going to study, right? So next important thing in atherosclerosis is the acute changes in these atheromas. So sometimes, because of the high blood pressure, because of the high blood flow, because of the high pressure of the blood, these fibrous caps, they gets damaged and these fibrous caps are eroded, right? Or the endothelium and the fibrous cap both are eroded because of the hyperdynamicity of the blood, and that leads to the exposure of blood to the inner core or sometimes even the fibrous cap, right? So whenever the blood is exposed to anything apart from normal healthy endothelium, the process of coagulation starts taking place, right? And whenever this process of coagulation takes place inside the blood vessels, we call that as thrombosis. The formation of thrombus takes place. So these plaques, they become sometime they changes themselves and they become complicated. So that is called as complicated plaques. Right, so let us go step by step. First change is calcification. Right, calcification is when these atheromatous plaques, they develop the deposition of calcium salts in them and they become calcified. Right, so in spite of lipid, they start developing the deposition of calcium in them. Second is ulceration. Right, ulceration is when, as I was telling you, ulceration is when, because of the high blood flow, right, the fibrous cap the is eroded, right, and this atheroma develops ulcers. Right, the ulcers is the erosion of the endothelial layer. The endothelial layer and the fibrous cap is eroded. Right, so that is called as ulceration. You can also call it as rupture of these atheromas, or rupture of these atheromatous plaques. Right, number 3 is thrombosis. Right, so thrombosis, when this ulcerated or ruptured plaque, ruptured atheroma is develops ruptured atheroma develops the thrombosis. Right, when this fibrous cap and the endothelium is gone, then the platelets, they come and start depositing over this plaque, over this inner core. They start attaching, right, platelets. That is called as platelet addition, the first step. And after that, the fibrinogen will get converted into fibrin with the help of intrinsic and extrinsic factors, and that fibrin along with platelets forms a solid structure which is called as thrombus. Right, so there will be a additional thrombus formation over this ulcerated or over this denuded atheroma. Right, I hope you are getting it. Right, so that is called as thrombosis, the acute changes or the complicated plaques. Then there is one more, hemorrhage. Hemorrhage is when the blood vessels, the blood supply of the blood vessels, the vasa vasorum, becomes ruptured, and this plaque is filled with blood. So that leads to the swelling of this plaque because of the hemorrhage inside it. So it will become swelled up and it will it will stop the blood flow through the blood vessel. Right, it will occlude the space of the blood vessel. Then fourth is aneurysm formations. Right, you read it by yourself.